Welcome back. Yes, indeed, still focusing on this part of the COVID component. We've got Dr. Aliyu Sokomba joining us from Abuja. He is the President of the National Association of Resident Doctors, NARD. Good morning. Thank you for joining us today. Well, about these figures now, the cases that NCDC has released of total confirmed cases of COVID and having the highest number ever since this index case in Nigeria. Were you surprised at these figures? What do you think of it?
Well, thank you very much for having me. Well, as it stands right now, the Nigerian government is making efforts to contain this disease, but it's obvious that a lot needs to be done. We can do more. As it stands right now, we have not done adequately enough, so I'm not surprised that the figures are beginning to rise. The trend of the new cases is beginning to rise. At the outset of this outbreak, since this outbreak broke out about 9 weeks ago, so far we have only tested about 7,000 people in Nigeria, and out of which we are recording about the 627 people that are testing positive to this disease. In about the same period, Ghana, our near neighbor, had tested about 60,000 people, and South Africa has tested about 108,000 people. And so the more people are tested, the more people will be identified, they will be isolated, and the spread of the disease will be contained. So from what we have on ground right now, it's obvious that we need to do more in testing people, and by so doing, we'll be able to identify more people, isolate them in good time, and prevent further spread of this disease, which as we speak right now, we are not yet there. So I think a lot more needs to be done with regards to testing of people that have this disease. Secondly, beyond the disease spreading in the community, which I believe we are all aware of, the disease is already at the community level, we are beginning to have a situation where this disease is now going to be spreading in the hospitals. We're going to be having hospital transmission of this disease, which is going to be a very serious condition, because unlike what is obtainable in communities where one patient can just spread it to 2 to 3 people, if we are having hospital transmission of this disease, we will have a situation where one healthcare worker, a nurse or a doctor, will be spreading this disease to as much as 50 to 100 other patients who probably have come to the hospital to seek care for their regular ailments. And this is already happening in Nigeria, so I'm not surprised. We have this already happening in several hospitals, like the University of Ilorin Teaching Hospital, where a patient was seen,
could you tell us,
was being managed for his...
Okay. Could you tell us, why is this the case? I mean, why would we have hospital transmission? Because, look, this is going to be scary. The last thing anybody wants is people not confidently going to the hospitals. Why is that the problem?
Thank you very much. Well, there are 2 reasons why we are beginning to have hospital transmission. Number one, we are not doing adequate testing. This is because we have continued to rely on the surveillance case definition, which we instituted at the outset of this outbreak, sometimes 9 weeks ago. And it's still the same case definition that's being used in deciding who is qualified for testing and who is not. I think the case definition needs to be dynamic. There's a need for that to be reviewed at this point. The previous case definition, which we are still using anyway, emphasizes travel history. That has changed now. We're already having community transmission of this disease, so the emphasis on travel history can no longer hold water, because people are already spreading this disease in the community. So there's a need for us to review who should be tested. There's a need for us to change from this our passive surveillance that we are using to an active surveillance, where we'll go out to the community, identify people who have this disease, and isolate them.
But that's what FCT
so we are not
and Abuja are doing at the moment, community testing.
Well, I am sure that that has just recently been introduced, but even as it has been recently introduced, the guideline has not changed. I'm not aware any guideline change has been instituted. Secondly, the reason why we are having the hospital transmission of this disease is because we have been clamoring that these healthcare workers have not been adequately protected. We're not saying protect these healthcare workers for the sake of the healthcare workers. We are saying protect them for the sake of the other innocent healthcare patients that will be coming to the hospital for their regular health needs. So what we are saying is that though emphasis have been paid to ensuring that these personal protective gears are made available at the isolation and treatment centers, in the various hospitals we have across Nigeria, we still do not have these personal protective equipment. And so because we don't have it, we are exposed. And when we come in contact with patients who have this disease, which obviously we have to see because it's not written over on their forehead that they have this disease. There is no reason that says any person that's coming for his regular disease cannot have COVID-19. We end up getting this disease. And so when a healthcare worker gets this disease, there's a very high chance that this healthcare worker will transmit it to the various other patients they are seeing. So
about what you meant,
these are two basic reasons why we are having hospital transmission of this disease, which I think we cannot afford at this point because it will spell doom for our country.
So is it that the frontliners, I mean the doctors, the professionals think that these equipment are there and they are not being given, because I know countries are struggling to have this equipment as well. So what's the thinking that we don't want to procure it, what have you, we're not giving, or we're not doing enough to get it, to procure it?
Well, I think the people saddled with the responsibility of ensuring this equipment gets to the various hospitals are making this distinction that only hospitals where patients are being treated or patients are being isolated should be given the priority, should be given the attention to get this personal protective equipment, which is not the case because all hospitals across Nigeria are triage hospitals because they have to make this identification of these COVID-19 patients, and the more they come in contact with patients who seemingly apparently appear well, who probably are having this disease, the more these healthcare workers are exposed. So there's a need for us to have this reorientation that not only in isolation centers and treatment centers are healthcare workers exposed to COVID-19 patients. All over the country, all hospitals, all patients coming to hospitals are potential COVID-19 patients. And because we are not paying attention to that, these doctors are getting exposed, and it's already happening.
Let me try and understand your point.
That we don't have this
pardon me to butt in here again.
Because we said so.
Dr. Sokomba, is your point that every hospital in the country, doctors there should have the PPE? Is that what you're saying?
Yes. Yes, that's what it should be, because all patients across Nigeria are potential COVID-19 patients, because it is established at this point that we already have community transmission of this disease. All patients can come in for their regular ailments without knowing that they are having COVID-19. This is already evidence in University of Ilorin Teaching Hospital, in University of Maiduguri Teaching Hospital, in Aminu Kano Teaching Hospital, in Uirua Specialist Teaching Hospital, in UCH. Let me give you an example. In University College Hospital in Ibadan, just yesterday, the president of the Association of Resident Doctors there informed us that he has tested positive to COVID-19. And this he had gotten simply by interacting with his regular patients. And what was is that he had not demonstrated any symptoms, and he just felt like being tested. He got tested and he's testing positive. This underscored the fact that there's a need for aggressive testing of almost all healthcare workers to prevent them from further transmitting this disease. So this Dr. Adedayo Williams, the president of ARD UCH Ibadan, wouldn't have known that he's positive if he had not just insisted that he should be tested. So this is underscoring the fact that we need to aggressively test all healthcare workers, because as they continue to come in contact with patients who seemingly or apparently are appearing well and coming to the hospital to seek care for other disease, they are also coming in contact with patients that are potential COVID-19 patients. So there's a need for personal protective equipment should be made available in all hospitals for all healthcare workers, because nothing stops any patient coming to the hospital for regular medical care from being positive to COVID-19. And the more these healthcare workers are exposed, the more we are heading for doom, because we cannot afford to have a situation where we'll be having hospital transmission of this virus.
You know, Dr. Sokomba, we've been told severally by the NCDC, the Ministry of Health, about, you know, talking about, you know, the people that have tested positive for COVID-19 without, you know, their consent. And now you mention a certain doctor in UCH. I wonder, did you get his consent about that before, you know, putting that out?
Well, the Dr. Adedayo Williams is a president of the Association of Resident Doctors in University College Hospital. He is a NEC member of the National Association of Resident Doctors, and I have he had informed me, and I'm sure he had informed me for me to take notes and take action on his testing positive to this virus. So the point is that I'm emphasizing this for the sake of others who probably have not tested positive, who have not tested positive, but are carrying this virus in our health institutions. So there's a need for all these healthcare workers to be tested to prevent them from further spreading this disease to their patients.
Right.
And just,
so, Dr. Sokomba,
3 years ago,
you have painted, I mean, the picture you have painted is really worrying. I mean, not just for, you know, medical workers, even for Nigerians, imagining that people that are at the front line are even not as protected as they ought to be from your account. And the question arises, when you escalated it, if you have escalated this, what kind of response did you get? Have you escalated this, and what response did you get?
Well, I have just been informed yesterday. He just informed us yesterday of his testing positive. But the point is that it's the same old thing that we have been advocating for. Provide personal protective equipment for all healthcare workers that are in all hospitals providing care for all patients. Because the emphasis is, if our healthcare workers are protected, then there's a very good chance that this disease will be contained. But as it is right now, our healthcare workers are exposed, they are less protected, and we have advocated, and it seems our advocacy is falling on deaf ears. So
Dr.
we will
Sokomba,
continue to advocate, and we'll continue to play our part as professionals.
Just one moment.
And we want to enjoin you as...
One moment. The question is, when you raise the issues around personal protective equipment for medical workers, the healthcare service providers, have you escalated it to appropriate authorities, the Federal Ministry of Health, the Minister, the NCDC Director General? Have you escalated it to any of them, and what response did you get? Well,
so far, the best I am able to do is to write. I have written so far. I've written the Right Honorable Speaker for requesting for an audience. I've also written the Senate President. I've written the Chairman of the Presidential Task Force. And we have been seeking for an audience to bring this to their attention, that the emphasis should not be laid only on those working in isolation and treatment centers. There's a need for all healthcare workers across Nigeria to be given all the necessary appropriate personal protective equipment to work with. Because as it is now, there's this distinction that has been made, which we believe should be done away with, that only those who work in isolation centers, only those who work in treatment centers should be provided with personal protective equipment, which is not the case, because all healthcare workers across Nigeria are attending to patients who are potential COVID-19 cases. And it's already evident that we are having community transmission of this disease. So what we are saying is that instead of focusing on only those working in isolation and treatment center, there's a need for us to get this personal protective equipment available in all hospitals. And so we have made several efforts to reach out to those concerned. We have written them, and perhaps someday we are hoping that we will be given the consideration to at least get an audience to speak up our mind.
Right. well, I'm glad you're speaking your mind right now. At least I believe they are listening. But also earlier on, you painted a picture saying that, it's possible for healthcare workers to even, infect others if they are infected. But from what I know about healthcare workers, they're one of the most careful people around. I mean, if doctors, nurses, and other frontliners are really careful, and you say that they might even be the ones spreading it to others, it doesn't quite add up for me, really. Can you break that down further?
Well, I am sure you agree with me that this disease is spread by contact. So as healthcare workers continue to interact with their patients, there's a chance that this disease will be spread from these healthcare workers to these patients. These healthcare workers attend to patients. They listen to them, they get to interact with them, they get to have contact with them. Yes, with the personal protective equipment, if they are made available. For example, you get to touch patients when you are evaluating them. You check their pallor, you touch them. You don't take BP at a
but Dr. Sokomba,
distance. You take blood pressure of a patient.
Dr.
Obviously,
Sokomba,
when you come in contact with such people.
Dr. Sokomba, just a moment. If I know, the little I know about your practice, don't you have to change the gloves? When you need to attend to different patients, and a lot of them, you have to wear masks. So I'm still wondering, how is that even possible?
Yes, so what I'm saying is that the personal protective equipment does not remove the chance of transmission in its entirety. The personal protective equipment only reduces the chance of this transmission. So the greater the contact, the greater the chance of this transmission occurring. All the people that have had this disease, especially the high-profile people, have gotten this disease even when they are protected. So this personal protective equipment does not remove the chance of transmission in its entirety. So what is best is to prevent the healthcare worker from getting infected in the first place, so that the chance of this healthcare worker transmitting this disease to others will be removed if these healthcare workers are protected in the first place. So
what did you mean when you said that the transmission is already happening between doctors and patients? Patients contracting it from doctors. You mentioned something in that regard. Could you clarify, please?
I don't get you. You said what?
Initially, you said that this transmission was already happening between doctors and patients, meaning that doctors, patients contracting it from doctors. So you were going to talk about where that is happening or how that is already happening.
Well, I said we are already having hospital transmission of this disease. I'll give you an example of what is obtainable in University of Ilorin Teaching Hospital. A patient presented to that hospital. Doctors evaluated him and felt that there's a need for that patient to be tested. But because of our rigid testing criteria, the patient was not tested in good time. So the patient was taken to the ward where other patients were being managed. So the patient was managed along with other patients that presented with their regular ailments. So when eventually the patient was tested and the patient tested positive, the other healthcare workers were tested. And these other healthcare workers were tested, and out of that, 5 healthcare workers tested positive. 3 resident doctors, 1 consultant, and 1 nurse tested positive. Unfortunately, the other patients whom the COVID-19 case was being managed in their midst were not tested. So nothing stopped these people, these other patients, from testing positive if only they were tested to find out their status. So eventually, unfortunately, they were not tested. So what I'm trying to say is we are already having hospital transmission of this disease, not necessarily doctors transmitting it. I'm so worried that we should make sure we protect these healthcare workers so that we don't get to a point where these doctors will be transmitting this disease in multitudes to their patients that they are attending to.
All right then, Dr. Aliyu Sokomba, President, National Association of Resident Doctors. Thank you for talking to us this morning. All right, I see, is this Penny Diamante? Well, he's talking about such amenities should be made affordable and accessible to the poorest of the poor. These include good quality education, healthcare, housing, power, water, good roads, food, employment. Which amenities are there? Okay, these are the amenities that should be made available to the people.
Yeah.
All right, we hear you.
And this one talks about the conversation we had about Nigerians in China. The Midas Michael says the wanton ill treatment of Nigerians in diaspora by their host, wow, wanton, is as a result of government continued complacency and condescension to countries considered superior, creating excuses for slow response to their issues. I mean, that's his perspective, but I'm sure a lot of his ministries and embassies might want to take you up on that and maybe disagree or clear the air. But that's Alabi Michael for you this morning.
Agbo says the informal economy is massive and we don't have a grasp of its size or depth. Well, economists might disagree, but when you examine our varied societal expenditure and even import components at multiple levels, it is obvious a huge disconnect exists and we may be misreading poverty.
Oha says, I like the question about why didn't NAPEP facilitate the development of social security numbers? I heard that question from Chamberlain. The National Planning Commission and other MDAs should see it as a priority after this pandemic.
Okay, then Charles says, I am scared and disappointed about the demography from the figures. I know young people force their freedom and love to sneak around. Please, a lot of interstate movement happen at night. People are moving to villages to cause more spread.
Whew, wow. Chidose Waigwe says, I honestly expected this exponential leap in COVID-19 figures. Immediately, some states allowed free movement during the Easter celebrations. Increase in transmission was inherent. This should serve as a deterrent. People should be kept indoors. It is safer.
And this one comes in from Marshall. Says quite worrisome the issue of COVID-19 cases and deaths recorded so on, but no one seems to be talking about the fact that police is killing more than the coronavirus is killing. Yeah. Well, I'm wondering where you have your figures from, but it's something to chew on.
Oh yeah, there have been quite a number of extrajudicial killings as a result of trying to enforce the COVID-19 lockdown. Kaduna easily comes to mind. But that's definitely something, as you said, to chew on. Let's look at this one from Ugo, who's very worried about what's happening in Kogi State. He says, I don't see why Kogi is still not on lockdown by the federal government if the state government is not locking the state down. Marriage ceremonies with more than 50 people and religious activities still hold. Markets and bars still filled up. People still travel into the state from Abuja. Streets still filled up. NCDC should come and commence testing here in Lokoja, and you'll be shocked at the figures. Well, I did know that Sheun Okinbaloye spoke with the governor of the state yesterday, and he was saying, well, if we haven't seen any symptomatic person, why should we be tested? But as the DG of the NCDC did say in Imo, we can only be happy when a state has not has not recorded any case. When we have been conducting tests there and we haven't seen any cases, and that's when we can be truly happy for that state. So maybe Ugo does have a point, and it's something that the NCDC should look into. Gentlemen.
Is there anything wrong in testing people if you haven't seen any symptom or any case?
Well, at this point, no, I don't think so.
Well, there isn't anything wrong, but perhaps the issue a number of people are considering is the availability or otherwise of the testing stuff, which is...
We have to be aggressive with tests, they say, and
well,
so
if we have all of the capacity to,
all right, we need to go. That's it today. Thank you all for watching. Not to worry, we'll see you again tomorrow. Don't forget, stay safe. I'm Chamberlain. What's up?
Well, yes, we all need to take responsibility, but we'll be fine, definitely. I'm Kayode Okikiolu.
And I'm Ayo Makinde. Oh, Maokwe.
Please don't forget to wash your hands. I'm Maokwe.